Data from the CDC reveals that just 6% of COVID-19 related deaths in the United States listed the virus as the person's sole cause of death. While the data shows that the majority of those who died from the virus had underlying health conditions, medical experts say it doesn't mean the virus is any less lethal. 12 News reporter Rob Nesbitt joins us now with more in-depth coverage.
Rhode Island's percent positive rate has been at its lowest since the pandemic started 6 months ago. The state's medical experts are saying there's still a long road ahead.
Also, low test positive rate.
Governor Raimondo seemed optimistic Monday with where the COVID numbers have fallen, a positive rate of 1.2%.
This should give you confidence that here in Rhode Island, we're doing about as well as you can be doing.
More than 45,000 people were tested in the last week, according to the governor, but the numbers are still not enough to take Rhode Island off of Massachusetts' restricted travel list.
So tomorrow is day 184, and I do actually count the days.
Medical director for the Rhode Island Department of Health, Dr. Jim McDonald, says that 6 months in, there's more of an understanding of how the virus spreads and what to do to prevent it, reiterating that underlying conditions are what put people at an elevated risk.
Or you have diabetes or hypertension or obesity, you're in a higher risk group. And those folks regrettably are more likely to pass away from COVID than others.
Dr. McDonald says it's not possible yet to tell who's more apt to spread COVID after receiving a positive test result. That's why he says it's more important that all Rhode Islanders continue to take preventative measures as seriously as possible, particularly going into Labor Day weekend.
And if we do not live differently during this pandemic, and we are doomed to perpetuate this.
Dr. McDonald says that for every flu-related death last year, there have been more than 50 connected to the coronavirus this year. Reporting in studio, I'm Rob Nesbitt, 12 News.